My presentation is titled Don't Stop Me Now, HealthLink Downtime Planning, because we certainly don't want to be stopped from providing all of this remarkable healthcare. However, I appreciate you coming. I hope this is something that you never have to use, but if you do, it's certainly good to be aware of what we're about to discuss. So first question, either by interjecting into the sound or by putting it in the chat box, what would you do if you experienced a sustained, unexpected HealthLink downtime while staffing? And these were the options that came to mind for me, so I'll give you a second. All right, so I'm seeing a mix of things in the chat, and if you're like me, I am certainly doing all of the above. I am going to cry, panic, and then I'm going to retire before this could ever happen to me again. So hopefully by the end of the presentation, we have a little bit more confidence in ourselves than here. However, we don't currently. So this is from the survey that I sent out last week via email, where we were looking at how confident do you feel during downtime? And you can see red is obviously bad. We have over half of us who are not confident or somewhat not confident. You know, a third of us are, we're okay. And then there are only 12 people total in the entire response pool of 75 people, ranging from technicians, pharmacists, directors, etc., who do feel confident in their abilities or very confident in their abilities during downtime. This is kind of what we expected. Over the January timeframe, I did the action agenda for the ISMP July through September period. And one of their points was to be prepared for unanticipated electronic health record downtime events. This is because we may become reliant on computer-generated alerts, and we don't really have great ways to respond to this. So some of the recommendations are to make sure that we have a plan, educate staff on our plan, simulate it, such as our planned downtimes that we have every now and then also make sure that we have the right people delegated to do that. While we have many of these things in place, our organizational assessment of this was that this isn't something that we're likely ready for on a grand scale. If we do have a sustained downtime or outages in our automation or the network, we're probably not prepared to handle that. And that is possibly because if you look at our pharmacists here, more of our pharmacists that responded to this poll do not know about our downtime procedures, and only 27 of the 56 who did respond do know. You can see that didn't have great numbers in responses from the other groups, but not good turnouts here. So that's hopefully the goal here, is to shed some light on these things. So after this presentation, I'm hoping that everybody can at least understand and some of the consequences, and then explain some of the strategies that we're using to prevent cybersecurity breaches, and then also have a knowledge of what our departmental resources are in times of downtime and how to use them, where to find them, things like that. So getting into the background of some of the cybersecurity attacks across the country, there have been plenty. For one example would be that Universal Health Services, which is an organization that operates 400 hospitals and behavioral health facilities in the United States and the UK, had a cyber attack. This article was published in 2020. They had to divert surgeries and ambulances in that process. The cybersecurity attack took down all of their IT systems. They were left without access to computers and phone systems. There was a cybersecurity attack in May of 2021 on Scripps Healthcare, where they lost $113 million in revenue and other costs that weren't quite calculated yet. They had to use paper records. That led to, or the attack in general, led to volume reductions, including emergency room diversions, as well as postponing elective surgeries. The University of Vermont had a network attack that was launched by an employee opening a personal email on a company laptop while on vacation. And because of that poor employee opening that email, they had 6 hospitals across Vermont and New York that were attacked, and they lost about $50 million. And then lastly, hackers in Broward County hit the Broward Health Network and exposed data on about 1.3 million patients and staff. So obviously problematic. One of the things that I found during research was that John Delano, who's a healthcare cybersecurity strategist, said that the healthcare industry is a prime target for attackers to monetize PHI and sell on the dark web or hold an entity ransom, unable to deliver patient care. As you can see with some of the articles that I showed you guys and some of the stuff to follow, this is certainly the case. The ramifications of cybersecurity breaches for organizations are decreased productivity, as you can see through all the losses that I showed you, decreased revenue, both because of the loss of services rendered, as well as the financial implications of these events, and then decreased reputation. This can really tarnish an institution's reputation whenever the patients don't feel safe with their information within the healthcare facility. From a governmental standpoint and monitoring all of our patients' healthcare, we have a lot of data at risk now. You can see just the vast number of patients who have been affected by these things, and there's more data on that coming soon. And then also societal implications. Because these things are costing the organization's revenue, it will lead to downstream effects that will increase the cost of healthcare for patients, along with the decreased products and services that are rendered for these patients whenever we have to divert emergency room visits, whenever we have to postpone elective surgeries. In 2020, this article titled it "A Perfect Storm for Cybersecurity Criminals," and it cost the industry $21 billion. Additionally, an IBM report says that the cost of a healthcare breach is up 42% from 2020. This data was published in 2022, or this is data from 2022, with the average cost of a breach being $10.1 million. So certainly no chump change there, definitely something to worry about on average. An article published in JAMA showed trends in ransomware attacks on hospitals, clinics, and other healthcare organizations over a 5-year period from 2016 to 2021. In this figure, the blue bars are the number of ransomware attacks, whereas the lighter blue line is the amount of PHI exposed. So you can see that we are trending up in both the number of cybersecurity or ransomware attacks that we're experiencing, as well as the number of patient health information that is exposed during this time. This one is showing entity-based. So on the far right, you can see that hospitals experience nearly 80% of their ransomware attacks that are targeted at hospitals lead to disruptions in operations. And on average, those operation disruptions are about 2 weeks in duration. So you can only imagine how much of a strain that would put on our health system if we had 2 weeks of downtime from a ransomware attack. And unfortunately, these two graphs show that the trends are not really working in our favor. So on the left, we have the number of patients whose PHI was exposed and the ransomware attack date. As you can see, as we go to the right of that graph, the amount of PHI exposed is increasing. And you have some particularly high events here with the hospitals going up to about 1.5 million for a couple of events. On the right, you'll see similar trends in that we are decreasing our reporting times, so we're not really getting action taken on these things very quickly. Some ways that we can prevent cybersecurity breaches are staff training such as this, or maybe CPTs, et cetera, that maybe give us some more hands-on exposure in being able to combat these events. Also staff training in regards to how to protect our information, making sure we're not sharing passwords, things of that nature. We have frequent software and system updates, as you know, and those coincide a lot of times with our planned downtime events. Also have endpoint protection for our devices, especially if you have anything related to HealthLink or WebEx or any of those on your phone. You'll see that you have these different apps that can help monitor and protect that. They require you to update your systems, like your cell phone, very frequently. Anytime that a new one comes up, I get a notification from the Hub app or an email even saying that it's time to update so that we can be the most protected possible. We have firewalls in place that can help protect our information. data backups such as the HealthLink Downtime app that we'll get into a little bit more that can be useful. Physical system access controls. These are the actual points of care where we're using this technology. So if you think about the badge access to get into the med room or something like that to actually protect the computers physically. Wi-Fi security, being passwords and things of that nature. Separate employee accounts are important so that we can make sure we're tracking what employees are doing and monitoring any suspicious activity. And then having, in that same regard, user access management, making sure that we have appropriate access and limit unnecessary access to certain information. And as we all know and love, we have passwords and multi-factor authentication, our 16-digit passcodes that are so fun to type in, and then multi-factor authentication on all of our personal devices to make sure that we can utilize the information we have. Some other things that we're doing, one of the JAR seminar, or actually the admin seminar discussions, we discussed with Troy Lapine, one of our chief compliance officers, about some of these strategies, and we are actually launching attacks at ourselves on an institutional level to try to identify our weaknesses before hackers can, because we know that it's unfortunately a reality that we have to face. And if we can identify our problems before somebody else can, then hopefully we can correct them before somebody else is able to exploit them. However, despite having all of these things in place, everything that we're doing to try to prevent breaches, healthcare data breaches hit an all-time high in 2021, and 45 million people were affected. So they're often inevitable. What can we do to mitigate these effects and maybe prevent them from happening at our organization? So one of the things that we did as an organization, we looked at our cybersecurity risk assessment. So the pharmacy department, mainly managers and directors, looked at these 5 categories and the downtime risk items associated with them to see what those impacts would be on our inpatient ops, our clinical operations, ambulatory operations, what the impact would be on medications management, and then also the business aspect related to pharmacy. They prioritized these events from 1 being the lowest to 5 being the highest priority. And then across everybody who was involved in this poll, we averaged the rankings to achieve a departmental consensus. This slide shows the 34 items that were listed on this evaluation. And can anybody guess what the most prominent response was? What would have the greatest impact on our organization, on our department as a whole in the event of a cybersecurity breach? All right, so it is HealthLink. Obviously, I mean, everything runs through HealthLink and Epic in general. Maybe not specifically HealthLink on the outpatient side, maybe it's WAM, but anything that would affect our Epic software would be a problem. So what do we do if that does happen? What if UW Health experiences a breach and we have some limitations for Epic and HealthLink? One of the steps following the cybersecurity risk assessment was to identify some business continuity strategies. So we are using a business continuity planning system called Sustainable Planner. Organizations can use these systems to look at things listed on the screen. So it helps us think about and identify what essential functions do we have on a department and on a specific level basis. What would be the impact if something occurred to that function? What would be the business impact? What does our bottom line say whenever something is wrong with that essential function? What IS applications are used? This is where obviously HealthLink comes into play, and we'll discuss the next several slides being the main focus with HealthLink Downtime application. How can we protect and also access any vital records that we need to help continue to have our business operate successfully? How can we communicate with one another, both communicating that we're in this time of downtime, but also communicating necessary for patient care and making sure that we can talk to the nurses, talk to other pharmacists, providers, etc. And then what infrastructure services do we have in place both to protect ourselves, but then also maintain our services as we go forward? So you guys all know and love this HealthLink downtime or HealthLink application icon that you see on the right. In times of HealthLink downtime, we do have this red application that you can access on any clinical and mobile workstations, being like your personal laptop, or not your personal, but your work issued laptops, as well as the main stations. The HealthLink downtime application is a snapshot of Epic before the downtime started, and we update every 3 minutes behind real time. The good news with this is that it does navigate basically exactly the same as the normal HealthLink application, with the exception that it is read-only, so you cannot enter any new clinical information, can't put in notes, can't verify orders and things like that while we're using the HealthLink downtime app. So that's where we would have downtime paper forms that we'll discuss shortly. The good news is that unlike more pharmacists not knowing about our downtime procedures, we do have a better response rate for our pharmacists knowing about the HealthLink downtime application. And as I mentioned, it does function very similarly, with the exception of the read-only capabilities, as our normal HealthLink app. So you'll see here is my patient list, and then what I see on my main screen, everything is the same. I have all of my lists still saved. I can see that there was an unverified order 3 minutes prior to the time I took the snapshot. You can see that the patient on the second line was about ready to discharge, and I might need to follow up with that. Obviously had the med history that was ready for review, different things that I can still access to be able to perform those functions. We also have access to our in-basket, and those are all saved, so you can see what was happening prior to the downtime. Also, order verification. You cannot verify these orders at this point, but you can see what orders were entered. Then you also have access to things like the patient sidebar summary and the notes that you pass off for handoff. Similarly, labs and vitals are available, along with basically everything else you may use in HealthLink, but I just wanted to make sure to show some of the things that we have available to us. So whenever we do experience these downtime occurrences, we do have the policies and procedures listed here. So the top one is maybe less important to your actual operations. It's kind of the plan for getting into this state where we are operating under downtime. That is located in SharePoint. I encourage you to try to find it at some point just so you know where it is. The one that will maybe be more useful for you is the unplanned HealthLink downtime procedure for decentral pharmacists. This is located in the J drive and our downtime playbook. Also, obviously, encourage you to try to track this one down and read through it. It's short 7 pages with much of the stuff reiterated from what we'll be discussing soon. But these are what we have available to us and kind of our guiding principles for our downtimes. In addition to utilizing the HealthLink downtime app, this will be kind of what we rely on for communicating with the other teams and making sure that we have continuous care for our patients. So some of our appendices that are listed in the previous slides procedure is the downtime physician ordering form, our floor stock ordering form, our dispensing form, a MAR form, and then also a med history note. So we'll go through each of these. The physician ordering form will be obviously filled out by the physician, but this is where we will go for our order verification. So we will need to make sure that we find this form prior to verifying and filling out the form on the next page that I'll show you. This is where we assess things for clinical appropriateness as we would in the normal verification queue. Once we have done that, then we have the actual dispensing form. So you fill out the top information, and you can see the italicized line in the middle there that says the pharmacist above has reviewed medications for clinical appropriateness. So that's what you did on the previous page. Now we're going to go down and we're going to fill out and actually get these medications up to the floor. One important thing to note is that if a medication was ordered previously and there's an active order that's already stocked in like the Omnicell or something like that, you can still pull those from the Omnicell, so this won't be necessary at that point. But this is very important for any new orders. And then we also need to make sure that we can get, if this is a very sustained downtime, then we need to make sure that we can get doses for the next day and things like that. Central pharmacy will also use this form whenever they fill out the medications to get them up to us. So you can see the right column there is the number of doses sent by Central, and the central pharmacist also needs to sign off on that. The medication history note is very similar to what you may follow in a normal process for the RX snapshot. You may be able to access the RX snapshot as long as the HealthLink Downtime app is available, and you might be able to print it depending on the level of network downtime that we're having. So you may be able to just follow your normal procedures if you utilize the RX snapshot. If not, this form kind of walks you through all the steps where we still have allergy section, we have the med section, and then a place to verify or assess the immunization status, normal things that you would do in your admissions process. The pharmacy floor stock list, this is used normally, even in times of lacking downtime. So in normal operations, our technicians from Central Pharmacy are taking care of this. A lot of them will even just check these things on a daily basis, and this is less important for the downtime aspect. So this is one of those things where it's just here for your information if you're asked about it. In downtimes that last 4 hours or more, we will have to switch to a paper MAR to be able to track these medications. So there are some caveats in the procedure regarding MARs that I would just encourage you to refer to as you're filling them out. If you are in, make sure you review the procedure, and then if you need to, unfortunately, go to this step, be sure to have that available and fill this out appropriately. There are some caveats where you may not need to review different medications on some of those other forms if you are the person, if the pharmacist is the person entering the medications onto these lines that shows like a review for clinical appropriateness. So that is what we have for the main items for HealthLink Downtime. And now I'm repeating my question from the beginning, and I hope that many of you will at least have a little bit more of a positive approach to it, maybe have some more confidence in yourselves to give it your college try and do your best. So since this is something that many of us had lacked context on, didn't feel comfortable with based on those survey results that I showed you at the beginning, wanted to have some time. I have Aaron as my content expert who helps oversee a lot of the emergency planning, and also I believe Jeff is on here for his MS project was related to downtime planning as a whole across the entire department and not just in HealthLink. So I wanted to make sure that anybody who had questions and didn't feel comfortable with this information could ask them now. If it's something that I know the answer to, obviously I will do that. But if it's something that is out of the scope of this grill presentation, I can ask Jeff and Aaron to chime in. So if you have any questions, feel free to unmute, raise your hand, whatever you want to do, or throw them in the chat and we can try to address them. All right, unless somebody's typing vigorously right now, I don't see any questions. So that is all that I have for you. And I hope you guys have a great rest of your day. If you do have any questions, feel free to send them to me and I can try to respond or route them to the appropriate person to help you with that information. So thanks for coming out to grill. Again, the grill code is breached if you jumped on late, and everybody have a good rest of your day.